Again, just buzzwords from before. Web 2.0, we talk about the transition from the old way of the web, which was very static, pages like GeoCities, all the old stuff that some of you probably don't even remember, to sort of the new web, which is contribution, dynamic, interaction, info gets pushed your way. We kind of talked about this concept before of, you no longer being a private citizen, you no longer being that individual, but as a physician, you're now sort of this public entity that has this big voice that you can either choose to distribute or not distribute. And so when we talk about, as Dr. Vardabadian said, what you say and do, online really matters. And because of these, stats like this is from the Pew Research Group, 65% of Americans participate in some sort of social network, and that's just across the board. 80% of users on the internet look up health information. So when you're looking at that large, overwhelming majority, if you are going to be a physician that isn't in that population, you're limiting yourself to what access you have to patients, to colleagues, et cetera. And so when you ask, well, with that number, the 65% and the 80%, what degree of or what percentage of physicians are using social media themselves? And it's really kind of a hard question to answer. And when you start to think about, well, why can't we answer that? When you look at the research that's out there for how many physicians are using social media, a lot of time it's about this concept of, well, physician use versus physician use. And it's just a matter of how you actually phrase the questions. So here's one example of what I mean. So this is a very recent study, Journal of Medical Ethics, 2011, looked at 202 residents and fellows at their institution. They looked at Facebook specifically. 73% were on Facebook. And then they asked them, how often do you go on Facebook? Pretty good estimation, right? So with those kind of questions, you had 24 and 28% that were accessing daily, several times a day. So more than half of these residents and fellows who were on Facebook were accessing Facebook daily. So you're like, well, okay, so if you're looking at general numbers, about 3/4 are online, 3/4 are engaged in social media, and they're doing it on a relatively daily basis. But that was the question. Do you go on Facebook? Do you have a Facebook account? And that's not really what you want to ask about when you're trying to figure out what physicians or residents or med students are doing on social media. These surveys are asking the wrong kind of questions. So just to say, do you use Facebook, do you use Twitter, how often do you access this, that's not insightful at all. What you're really trying to get at is, a question like this: what's the overall frequency of using social media to contribute medical knowledge to your colleagues, to your patients, to your peers? Those are the kind of questions that you want to know. That gives you better data. So a study just recently came out. Actually, Brian Vardabadian was on the study. They presented this about a year ago, one of the first abstracts. But they asked those sort of more insightful questions about social media. This is the Journal of Medical Internet Research, web-based journal. And so this is kind of a complex graph. But they asked, specific, very pointed questions to physicians, asking them would they use these social media outlets for interacting with colleagues or interacting with patients, and the numbers are a lot lower. Restricted online communities, the far right side of these graphs tell you people that are in favor of using it. The far left side of the graph tells you people that are against using it. Restricted online communities, places pretty much password protected, not in the public. People are relatively comfortable with that. But when you start talking about YouTube, Facebook, podcasts, we're getting into the low, 30%, 20%. And so when you talk about physician comfort with doing medically related things online, pretty low compared to the general numbers you see out there. A couple other studies, frequency of using social media, and this is again frequency of using social media to post medically related content or teaching content, not just generally, because if you go on there and check and put a birthday notice to a friend, that's not the kind of Facebook use they want to talk about. They want to talk about, are you disseminating, good information, good journal articles, that kind of thing. And again, the numbers are sort of in that, 16, 19, sub 20% range of physicians that are actually using social media for this purpose. And again, another sort of graph looking at, do they feel social media for medical purposes waste of time, risky, high quality info, low quality info? The overwhelming majority, 47, 51% are really unsure of what social media's role can and will be, with about 33% saying it's probably useful. And then when you talk about, can they help use social media for patient care, a lot of them say, well, yeah, possibly, but a lot of them from the other parts of the survey really don't know how to do it. And so you sort of have this desire, you see that it's out there, you see it's so pervasive with social media, but people aren't really sure how to use it effectively. So when you go back to these numbers of 65 and 80% of the general population, you know, it really kind of skews what you're actually looking at. And what Brian talked about, and I want to go through some of these examples of people other than Brian that are doing really interesting things. He talked about Wendy Sue Swanson. I heard her speak at the same conference. She's very amazing. So what Brian does, he blogs a lot about being a digital physician, not so much about patient care, but just this whole experience of being a doctor in the digital age and how to make those two pieces work, talking about literacy, training residents. What she does is very different. She focuses on patient education. So not so much for her colleagues, but this is for her patients. So she describes herself mother, pediatrician, blogger, Seattle Children's. That's her name, Seattle Mama Doc. She won in 2011 the CDC Childhood Immunization Champion Award for all of her efforts online, which is a pretty big deal. And what she's done in talking with some of her talks is, you know, she describes that 65, 80%, saying that we need to be where people are. You know, everyone's online, everyone's on social media. And you know, what she said, a quote from her in one of the things, one of her transcripts said, you know, patients and parents alike are bombarded with information from a plethora of sources. As a result, people confuse individual experience with expertise. Doctors have a responsibility to help patients and parents sift through the information they read, see, and hear to be the voice of science. And I think that sort of is a good overall message. If you're trying to look at a place where maybe you could have an impact in social media, you know, being that curator of content for your patient population, I think is what she does a very, very good job of. And so she does a lot of these different blog posts. And because of that, you know, she works a lot clinically, but the hospital sees the value in what she's doing, so she gets time dedicated to social media, which is tremendous for being a clinician to have time to do this kind of effort. And her reach is, you know, above 8,700 followers. So she has her people in her practice, but the people that she impacts that follow her on Twitter, that see her on YouTube, we're talking about 8,000, 9,000 people that if she puts a post up there about car seat safety changes or law changes, that's going to hit 9,000 people. And not all of them are going to read it, but it's still a much broader impact than, say, you know, the 4 patients that come into your clinic during the lunchtime hour.
In perspective, you know, when we talk about this FDA warning, what we're worried about is overdose. And why we're worried is that the tools that families use to give medications are really different. So when I took a random sample of our medicine cabinet today, I had some infant acetaminophen or Tylenol drops. I had 2 forms, one without color, one with. And between the 2 different brands, we have slightly different droppers. This is a longer and more narrow dropper that's hashed off at 0.4 and 0.8. When I look at this preparation of the exact same medicine, the hash marks are in slightly different spots and the dropper is different contour. If you can see here, 1 milliliter of liquid vitamin D is nearly the whole dropper. But when you compare that to infant acetaminophen or infant Tylenol, you'll notice that sometimes when we give a child a dose, we only give them half of a dropper full. So it can be confusing, and you really have to be careful about how you use the dropper you're given.
So she kind of goes on in a little bit more detail and talks about the different dosing for children and how to actually do safe dosing just based on the different bottle sizes. And this is probably a 2-minute video at most. But she said in one of her other blog posts, she does this, you know, when she's in the office with her patients, she says this over and over and over to her patients. And so now instead of doing that, she can refer them to the blog site. They can look at it on their own. If they're scared to ask, I don't know how to dose medications for my child, they can go online and always have access to that kind of information. So a lot of it is that repetitive information that you're using to either provide more education or just to reinforce certain facts that you have in your patient-physician encounter that you can follow up with these sort of videos. And she uses video as her main method for communicating, as well as her Twitter feed. And so this is the homepage of Seattle Children's Hospital. You know, it's like going to the UCI homepage. Very prominently featured on the page is her blog site. So again, she's probably one of the biggest components outward of what Seattle Children's does. And she has, you know, on her site, you know, there's the blog site that ties into the videos, and she has very timely posts up there, you know, about flu. What she does in a lot of her videos, it's videos of her and her kids getting flu shots, so it's not just, you know, I'm a physician, I'm telling you what you should do. A lot of it she tries to kind of relate to her patients, saying, you know, in addition to being a physician and a blogger or someone on social media, I'm also a mom, I would do this for my children. And a lot of the posts she writes as, if it were my child, I would X, Y, and Z. And so that helps, I think, a lot of patients who are maybe on the fence about certain things, when they see another physician and watch a video and read a blog post about what they're actually doing, that it provides more of a positive example.